Good morning, everyone. My name is Dr. Vikaskumar Patel here at Olney Dental Wellness. We have received many questions about the difference between the gingivitis and the periodontitis. Today, I'm going to take a moment to answer all of those questions and try to explain you the difference between the gingivitis and periodontitis. What are the symptoms which are different between those? How can you spot if you are having any symptoms associated with the gingivitis or a periodontitis? What you should do if you have those symptoms, how can you reach out to us and give us the answer? We are here to help you, but I'm going to break it down to the difference between both of it. In the end, I'm going to explain you the symptoms and the treatment for each of them. First question, most of the time, is what is the gingivitis? Now, gingivitis is the inflammation of the gum. Many times when the plaque which sits on the teeth transfer to the gum and is not being cleaned properly, that can create the immune response, which is the inflammation from the gum. Now, gum, in order to start to fight those plaque, they turn red. They create the inflammation can turn into the swelling of the gum, sensitivity of the gum. Those are the signs and symptoms of the gingivitis. Now, gingivitis sometimes is easily curable. You can visit your dentist every 4 to 6 months, depending on their recommendation. And if you maintain proper cleaning, we can maintain and cure the gingivitis at much better rate. Periodontitis, on the other hand, is a little severe form of gingivitis. What happens? Those plaque, when they sit on the teeth, on the gum for a very long period of time, they transfer below the gum and they go on to the periodontal ligament, which is actually between your teeth and the gum. Periodontal ligament, when they start to get inflammation, it leads to the bone destruction and your bone loss will start to occur. Sometimes you feel the loosening of your teeth also. That's why the periodontitis is a little more severe form of the gingivitis. Now, in order for the treatment of that periodontitis, sometimes it is not just like a regular cleaning. Your dentist or your hygienist may recommend, sometimes you may have heard it's called the deep cleaning, because they may have to go a little more deeper than below the gum, on the gum and the ligament to clean all those inflammation and infection. Sometimes you may need help of antibiotic, and in some severe cases, you may need a laser treatment or we call like a flap or surgical approach. So these are two main differences between gingivitis and the periodontitis. Now, the second most question we usually receive are what are the signs and symptoms of those gingivitis? So number one symptoms is red and swollen gum. Sometimes you notice your gum are puffy, they are red. Second symptoms you may notice are the bleeding gum. If you touch your teeth while in the morning while you're brushing your teeth, or if you are flossing your teeth, if you start seeing that they are bleeding more than usual, that's a biggest sign that you have a gum disease. Now, third number is redness and the darkening of the gum on the area of the margins of your teeth or below the bone area. If you start noticing that your gum is very inflamed, they're red and it's getting even darker than unusual, your pink form of the normal healthy gum, that's also a sign of gingivitis. Other signs of the gingivitis are if you or your significant partner or somebody notice that you have a bad breath, or you may start noticing that you have a bad taste in your mouth. That's also a sign of a gingivitis or a periodontitis. Another symptoms you may notice, some people will definitely notice, are in the morning or in the daytime, where they usually start feeling that their teeth are not fitting properly, which they used to, which we call like a malalignment of teeth, or you feel your teeth are shifting. And that's mainly happen, as I'm explained, when you have a severe form of the gingivitis and the bones start to lose, teeth start to change and they start to shift. Your bite is not as which you used to have it before. If you're starting to feel those bite changes, that's also a sign that either you have a bone loss or some form of gingival inflammation. If you are having any of these kind of symptoms, it is very important to call to us or speak to a hygienist or any of your dentists to schedule a visit so they can take a look at that, whether your gum is having any kind of inflammation signs or a bone loss. Because gingivitis, if it's caught early, it's very easily treatable by just regular cleaning. Or if you left untreated, which can turn into the periodontal disease, which is a little harder form and which is hard to maintain because it may need a little more extensive treatment. So please give us a call if you are receiving any kind of a symptoms. Now, other question we always received is how dangerous is the gingivitis? Now, gingivitis by itself is uncomfortable because you have a swollen gum, bleeding gum. By itself is not a dangerous if you're able to seek a treatment through your dentist and if you are able to cure that disease. Become a little more uncomfortable and become a dangerous and critical in a situation where if it's left untreated, that can lead to the periodontal disease, which are a little more advanced form of a disease, and you may start having periodontal ligament issue, loosening of your teeth, and sometimes you may even have to extract those one or multiple teeth. So if it's not treated, that can lead to a dangerous situation. Now, in addition, gum disease many researchers have linked those gum disease with your health condition, such as heart condition, diabetes, your lung issue. Some research not concluded, but they are even suggesting that they may be linked between your gum disease and the Alzheimer's. It is very, very important to seek a care at early stage. As soon as you start having any symptoms of gingivitis, go and visit your dentist, because you don't want that easily curable, which is gingivitis disease, to turn into the little more advanced form of periodontitis. Can gingivitis and periodontitis happen at the same time? Yes, it is possible to have both of the gingivitis and periodontitis happening at the same time. In fact, the gingivitis is often the early stage of the periodontitis. When the gingivitis is left untreated, it leads to the periodontal disease. The progression from gingivitis happens when the bacteria or a plaque which are sitting on the teeth and below the gum are left untreated, turn into the tartar below the gum line and cause the gums to pull away from the teeth, which create the deep pocket. Now that deep pocket can harbor more bacteria, more plaque, more food particle, and it's harder to clean those deep pockets, which increase the process of bone loss. Now what start to happen is, because of those issue, because of that starting having those bone loss issue, teeth starts to shift. You may sometimes even start to lose your teeth, start having a bad breath or swelling. So it is very, very important to start seeking the care to the dentist as soon as you start seeing any signs of a gingivitis, like inflammation or a bad breath, because it's very easily treatable at early stage. One goes beyond to the gingivitis and turn to the periodontal disease. They may require more treatment, like going and cleaning those deep pockets, that usually called as a deep cleaning, and may require more than one visit. So please give us a call as soon as you start seeing that you have any kind of symptoms, which is the gingivitis. How do dentists treat gingivitis? In order to treat the gingivitis, you need a diagnosis. So that's why you need a comprehensive oral examination. Your dentist will perform a full set of an X-ray to see if you have any bone loss. Sometimes your hygienist or dentist will go and check the pocket of your gum to see if you have a deep pocket, or checking the redness or swelling of the gum. So you definitely need a full comprehensive oral examination so we can decide whether you have a gingivitis or a periodontitis. Now, once you have a proper diagnosis, there are two main goals of the treatment. The number one goal is to remove those plaque, bacteria, and tartar. And the second goal is preventing that things from happening again, and how can we help you to maintain the healthy gums. Now, in order to remove those tartar, bacteria, and everything, you need a proper cleaning. If you are just a gingivitis, maybe regular cleaning. We may recommend you to how to properly do the oral hygiene, which is brushing twice a day, flossing, sometimes even using the mouthwash. Now, if you have a certain little advanced form of gingivitis or periodontitis, your dentist may recommend sometimes called a deep cleaning or a scaling in the root cleaning. In that treatment, your dentist or hygienist will have to go a little more deeper on the gum, clean those plaque and bacteria, clean and root surface area, so that new attachment can start forming, and those deep pockets will start to go away, or in some cases substantially number will be less. So you're not going to have those deep pockets, which is easily cleanable, and you can maintain some kind of a good oral hygiene at home by yourself. Some of the cases, your dentist will also prescribe you antibiotic. If you have any infection, then you can have a systemic issue with that. So your antibiotic also can be used to prevent or treat gingivitis or periodontal treatment. Some of the cases, we will also recommend you to have a night guard, or having any kind of Invisalign treatment if your teeth has been shifted and you have alignment issue and lot of stress, or more your bite is causing those inflammation to even increase. You may be advised to get a night guard or the orthodontic treatment, so that your gum and your periodontal ligament can heal properly. Other time, we usually suggest our patient and try to help them to life modification. If you are too much stress, if you're clenching, grinding your teeth, or if you are drinking more sugary product like a drink, sodas and everything, we try to work with you, try to get the idea of what's your lifestyle modification and how can we help. In every case, it's where if the gingivitis in early stage is very curable, it's very easily maintainable. That's why it's very critical to seek the help of a dentist at early stage. Another question which we received is, when should I schedule a dental appointment if I suspect I may have a gingivitis or periodontitis? Now, if you suspect that you have a gingivitis, and I'm going to explain you what are the signs and symptoms you may be having it. It is very important to schedule a treatment or at least a consultation with your dentist as soon as you start feeling that you have any one of the symptoms or multiple symptoms. And one of the number one symptoms are if you have a bleeding gums. Every morning when you start to brush your teeth, and if you start seeing, or flossing, if you start seeing your teeth are bleeding more than usual for a few more days, that's the biggest symptoms. If you start seeing that you have a swollen or a puffy gum, we recommend you to call us right away. If you have a persistent bad breath, if you think your teeth are shifting, your teeth are not feeling as the way you used to be when you bite down your teeth, and you have a malalignment issue, that's also another sign of a symptoms. If you notice any color changes in your gum, they are not a pink healthy gum, but you see it's like a very red or dark, give us a call right away. The reason you need to call your dentist and seek the appointment right away is gum disease is easily curable if we are able to catch that at early stage. The more it become, like when it's turned to the later stage of that inflammation, it is harder and harder to treat, and sometimes may need more frequent visit to the dentist, or may need a more frequent different kind of a treatment, more extensive treatment than the regular cleaning. Another advice I would say is stick it to even somebody who doesn't have any gingivitis or anything. It is very important to maintain your 6-month visit, because at your 6-month visit, your hygienist and dentist will be performing a thorough evaluation, not only your teeth but your gum. If they suspect any early signs of inflammation at that stage, they may be able to recommend you the earliest treatment, so you can prevent that even happening, all those expensive deep cleaning or any other kind of a treatment going on there. So even just by showing up on your 6-month visit, that's also a biggest advantage you can have it on your side to show up on there. So depending on your how your signs and symptoms you are feeling it, please give us a call right away, because severity of that disease affect how easily it can be curable.